we don't need to be adversarial, but I do think we do need to put some questions out there. And Shawn and I have this doctor, his pedigree from his schooling is just, unbelievable. Yet at the same time, he's still in that field of, let's give him all these statins and all these high blood pressure, and we're listening to him and we're like, how's that been working? How has that been working?
Right.
And this week in particular, I have a client that came in and she lost 30 pounds, and her naturopath, sat down with her and she actually listened to her, right? I mean, they had to come to Jesus moment, I think, with each other. But, she knew what the answers were. A lot of times patients do, or clients do. They just need either a direction or some motivation, and they work together. And by gosh, she doesn't have side effects from taking the statin or Ozempic, or, she's not having to go in because her gut's not working anymore. I mean, there was things they had to work through together, but that to me is much different than giving somebody, all these pharmaceutical drugs that we've been doing for 30, 40 years for cholesterol and hypertension and cardiac disease with the same outcome.
Yeah. Well, and your point is well taken, because there's the thing we have to swallow before we can shift into a new parallel system is to recognize there's no easy button. There isn't a solution to fix your health problem that comes with a brown bottle and a white cap. That doesn't exist. It's lifestyle, and the advantage that the pharmaceutical industry has is they can sell us the easy button, and we continue to fall for it. Like all the complex reasons why your health is failing in the first place. Never mind that. We'll just go ahead and give you a pill, and you can carry on.
And by the way, your insurance will cover this.
Right. There you go. Right. And it doesn't cost you anything because it's all part of our centralized system. Right. We haven't even gotten an egregious thing called the sham of health insurance and what that does. So that world is just once you can kind of towel off and metabolize that, I'm going to actually have to work at building health and going to bed on time and eating better food and drinking water and exercising and getting time in nature and all the things that we are all the biological laws of physics we're all bound by. Yeah. And once that's not a impossible dream, it's just a thing you recognize you grow into over time, just like gardening or any other thing that you would do. You don't master it in one day, but there's no pill for this. You can have health, or you can have managed sickness and crawl to the finish line for a few decades, if you're lucky, or you can build health. And if you plan to be around for longer than a year or two, you have the time. Like, it's going to go by anyway. We might as well start shifting some of our behaviors so that I can grow and earn health and then keep it. That's such a more fun way to go through life.
Right. Well, just remember, I personally think that our friend Robbie Ross says there's never a bad time. Start now. And it comes to mind, I had an uncle who just reached the point where he had a sack of medications, diabetes, hypertension, you name it. He threw it all away and walked away from it. And he actually lived the last 10 or 15 years in a very good way of living, right? Like he said, this is, I'm done. This is making me sicker than what I was coming in the door to see my doctor. I'm through with you. Mm-hmm. And, quality versus, like you said,
quantity.
Yeah. Right. And the more people I think out there that realize that and see that, hey, it is like everything he said. It's, he lost weight because he quit overeating. He got outside. He started moving. It's like getting rid of that cane. I'm going to move. I'm not going to sit in my chair. I mean, that sack of medicine actually kept him there. It was like he was chained to it. And he was like, I'm done.
And all by design, really.
Right.